expectations and perceptions affect Bible study and Bible reading. Consider the following incident reported by Dr. Bruce Molina. It doesn't have anything directly to do with Bible reading and Bible interpretation, but it does have a lot to inform us about all human interpretation, including biblical interpretation. The following story illustrates how presumptions based on one's own preconceptions and lack of awareness of what others mean in their own social setting may affect their perception. Almost 40 years ago, a psychologist at Stanford University directed the following experiment. 8 sane people gained secret admission to 12 different mental hospitals located in 5 different states on the East and West Coasts. The quality of the hospitals varied from old and shabby to quite new, research-oriented, and well-staffed. All but one of these mental hospitals were supported by federal, state, or university funds. There were 8 pseudo-patients pretending to be mentally unwell. One of these was a psychology student from his 20s. The other 7 were older and established. 3 psychologists, a pediatrician, a psychiatrist, a painter, and a housewife. Except for alleging and pretending hallucinatory symptoms in order to gain admission, and falsifying their names, vocations, and employment to avoid identification, no further alterations of their persons, histories, or circumstances were made. Now, upon entering the psychiatric ward, each pseudo-patient stopped simulating any symptoms of abnormality. In spite of their show of sane behavior in the ward, in 11 of 12 admissions, the experimenters were each diagnosed as schizophrenic. In one admission, that pseudo-patient was diagnosed as manic-depressive. The perceptions of hospital staff, including psychiatrists, were so controlled by the psychiatric setting and by what they expected to find that these professionals failed to differentiate any of the pseudo-patients from real mentally unwell patients. Obviously, the foregoing experiment indicates for us the significant point that preconceptions and context color both the expectations and the perceptions that emerge in a person's interpretation of a social situation. Our expectations and preconceptions color what we perceive, what we interpret, what we think about, and how we communicate it. And that's true with reading also. Our preconceptions color what we read. Readers always bring expectations and perceptions into their reading, whether it be newspapers, comic books, college textbooks, or Bibles. Question: what do Bible readers expect to find in the book of Genesis, in the book of Exodus, or Ezra, in the gospel called John, in the document called 2 Peter, or in the book called Revelation? How do they perceive what they are reading? Consider, if Bibles were kept exclusively in hospitals, would not Bible readers believe that these books have to do with health care or getting well? And what if all phone books were the exclusive properties of churches? And what if all phone books were the exclusive property of churches? What if each person coming to church on Sunday, each Christian, brought his or her own phone book to church? People would then associate phone books as religious documents, right? And if that were the case, wouldn't religious scholars proceed to develop a sort of magical, onomatographical, and numerological hermeneutic of the phone books in question? Oh, that sounds bizarre. That sounds stupid. That's impossible. That's something out of Star Trek or the Twilight Zone. Are you so sure? Is that how you perceive?